A very warm good evening to one and all. Welcome back to the today's Sunday special episode of the webinar. Today we have our one of the renowned personality, Dr. Nagendra Babu sir. So we would like to welcome you, sir, with the warmest wishes. We would like to welcome you all the participants also today's for the exclusive session, and we would be grateful and first of all gratitude to you, sir. Like in a short while, you have accepted our invitation and you have been available for us for the extensive session. Thank you so much, sir. And coming on to the introduction to the sir, so everyone knows that without sir book, UG students and the PG students also who are from the organ department would never there complete this study. Sir is a renowned author of comprehensive study of organ of medicine, and also sir has written the other book, Introduction to Medica. Currently, sir is HOD and professor and HOD of Department of Medica from Sairam Homoeopathy Medical College, Chennai. We welcome you, sir, with the warmest wishes. We welcome you all the participants for this beautiful session. Hope this will be a great session for you all. Over to you, sir. Thank you, sir.
In fact, I am privileged to join you people. Thank you for giving me the offer. To start with, officially, I thank God, Master Heinemann, AIHSAYA members, all the members, and especially Dr. Lavanya for taking the pains and calling me and following me all the time. Thank you very much for this splendid and easy-going webinar. As I said, I am very happy to share my views on this platform. Thank you very much again. Now, today's topic, I feel this topic, when I asked Dr. Lavanya, she said most of the participants are students and a few members will be PGs and doctors or professors will be there. So I have chosen this subject because I have been into Organon for a long period and I have been taking Medica also. So since being an author of Organon book, which is well taken by you people, thank you very much again for that. Generally, what happens in my practice, what I have seen is by the time students, especially UG students, come to the final year, most of them are puzzled. Okay, so this topic, like try to put some light on how to practice rather, because I believe strongly right from my beginning that Organon is not a theoretical subject as we have studied in first year. It is not a theory because Heinemann only to communicate scientifically the basic principles of law of similaris, he introduced Organon. So I've chosen the topic, the title of the topic, Palliation is the first step to cure. This is a quotation you might have read from Dr. Burnett. Dr. Burnett feels that in general day-to-day practice, palliation is required even for homeopathic practitioners. Of course, PG students, after practicing for some time, you people will be, you got the answer, you might have understood the practicality of applying law of similaris. But for UG students, especially final year students, there will be a confusion, I feel rather, because most of my students have asked it. So I thought of addressing on this. So palliation is the first step to cure. I try to put this content. Being a Sunday evening, I don't want to bore you people by taking Organon classes. I try to concentrate more on the practicality of the subject by giving some cases my own practice. Right? So to go with, next slide, doctor. To go with, I feel these are the three topics generally we students come across. Even when I was a student, I have a confusion, rather a practical application. 3 points to be answered practically. I'm not going to the definitions here. Cure, palliation, and suppression. Cure, the ideal thing for every newcomer. We have to achieve cure. Yes, the ultimate aim, the utopian, rather, the greatest dream of every doctor is to cure any disease that comes to our clinic. But practically, that is not possible in every case. Even in 6th edition of Organon, Heinemann would have addressed. And 6th edition is the most practically possible application of law of similarities, I feel. Cure is the aim. Yes, we agree. But it doesn't apply everywhere. It is not possible, rather, everywhere. So we have to differentiate first cure, palliation, suppression. As I said, I'm not going to the definition. Cure is what? Total annihilation of the disease in its whole extent. Disease is what? Disease state. But rather, in philosophical term, it is not that. Total removal of the symptoms, purifying the body of the patient, bringing back the healthy condition. That is the highest ideal of cure, which we have studied in theories. Now, palliation is what? Temporary relief of symptoms. We address that also. Temporary relief of symptoms. So we are not trying to cure there. We are trying to relieve the patient from the greatest sufferings or presenting complaints for which the patient visited you and your clinic. This is allowed in homeopathy. This was accepted by Master Samuel Heinemann also, certain areas. Example, Aphorism number 67 footnote. Aphorism number 67 footnote rather will say, palliation is also allowed in emergency cases. Now coming to the suppression, not at all allowed in homeopathy because suppression happens at the cost of a new disease. We are not removing the disease, we are forcefully removing it. So disease jumps from one place to another place. This is the theory we have studied so far. So I'm keeping suppression aside, cure also aside, and how practically the palliation is applicable in diseases in our clinic. Next slide, doctor. Cure in homeopathy, right? Vital force is in a reactive condition. If you give some medicine, similimum medicine, it takes it, primary action, and obviously it responds to you. That is a quality of vital force. So either curative or palliative response it will produce. If you give the totality of symptoms, the cure will result. So vital force has the restoring capacity, right? That is why whenever any student confuses himself, I guide him. Whenever any patient or disease comes to your clinic, rather we'll address as patient, first differentiate whether the disease is in a curable condition or incurable condition. If it is curable condition, then only all the laws that you have studied in Organon 6th edition will come into play. Whatever you say, constitution, single dose, single medicine, dynamization, everything will come into play only when the cure is possible, when the disease is in a curable condition. If not, what to do? You cannot send the patient, no, my aim is only highest ideal of cure. I won't palliate. You cannot send like. Because our mission is to relieve the patient, right? So palliation comes into play in such conditions. So cure, please don't be utopic because it's a seminar, it is not a classroom. I thought of thinking more practically. So I'm telling you, I'm repeating several times. Cure is not possible in every case in our day-to-day practice. Palliation is needed. Yeah, next slide, please. Now, palliation, what it does? It, as I said, it temporarily relieves the symptoms from which the patient seeks the relief. Here, the cure is not possible. We'll take one case, one after the another. We'll try to examine or we'll try to analyze one by one the most annoying symptoms. This is what generally the allopathy does. We have been criticizing allopathy in our master's literature. Allopathy does majority of the times palliation only. So they relieve the symptoms, disease remains in its own place. In incurable conditions, we homeopaths are also going to do that. I feel generally, when I completed BHMS, most of the patients come and say, sir, homeopathy, it will take time. Homeopathy does not give instant relief. We don't think so, right? Example, even before Heinemann's time also, during Heinemann's time also, I would like to remind one case. Dr. Quinn, he belongs to England. He is a UK practitioner, Great Britain. He himself was an allopathy doctor. Later, he converted to homeopathy, and he is generally famously known in UK in Heinemann's time as the cholera doctor, because cholera was more prevalent in those days. It was the more fatal disease of the times, those times. And what Dr. Quinn does is, he used to separate. He had some 100-bedded hospital, assuming 50 beds he allowed for allopathy in those days, probably pre-antibiotic era, and 50 beds he allotted for homeopathy. And what he does, he used to maintain the dictionary, or he used to maintain the notes. And for his astonishment, those cases treated with homeopathy had a great success and recovery compared to allopathy. What he used to do, cholera being an acute disease, homeopathy works wonders with acute diseases. There we know that acute disease is nothing but exacerbation of the already existing latent sora. Aphorism number 5. You go there, exciting cause comes and it stimulates your latent sora. It aggravates, or it comes out, not aggravates, it comes out. The latent sora flares up and acute diseases will form. Acute disease is entirely different. The best example for this is cholera. So I just wanted to tell practically Dr. Quinn's explanation from the history, right? That is what palliation. You can refer aphorism number 67 footnote, where Heinemann also recommended palliation in certain cases. Right? Next slide, doctor. So what are the conditions, students or my friends, where we can think of applying palliation in homeopathy, where cure is not possible, it is impossible. Organs are affected, we have to recover the organs very faster. Remember, it reminds me, I just wanted to share. Remember, Dr. Burnett is the person who introduced organopathic remedies. See, in my classroom, generally, I usually does this with my third year and final year students. Homeopathy recommends dilutions, right? We want to use only diamizations. Then why in boric Medica, Justitia, Ravalfia, Cysism jumbolinum, all these remedies, the dosage is given either in 6x or 12x forms or in mother tincture form, right? So these are the remedies. They are the organopathic remedies. Along with your indicated remedy, along with your diet, Burnett recommends you to apply organopathic remedies, which cleanses the tissue or which try to save the organ. Generally, it came, so I thought of sharing my case. Generally, I apply this in liver disorders and pancreatic disorders, where the allopathy doctor might have given up the case, and people will come to us where allopathy fails, homeopathy comes in. That is why for final year students, I'll say, to enlighten them, to give a boost to their personality, I'll say homeopathy is a specialist to specialist. When specialist also fails, homeopathy comes into play. That is what the specialty of homeopathy. Right? So where organs are affected, where strength to the organs has to be given, where rather organs are damaged, you cannot recover. For the damaging, I'll share one case. In my earlier days of practice, I used to visit our college OP. I used to have duties weekly once. There I had a case of Mr. Vinayakam. Okay, he had repeated tuberculosis. He took treatment from nearby TB sanatorium. And unfortunately, that the TB he had is a drug-resistant tuberculosis. And unfortunately, he had to remove his lobes, partial lobes, because repeatedly there was a damage. And such cases, such Vinayakam came to me with fistula. So organs are already damaged and tuberculosis is affected. And he has been treated multiple times with anti-tubercular therapy by allopathy doctors. So no other go. He has to come to homeopathy. Here you cannot promise cure there, right? You cannot restore your organs. Homeopathy is not a miracle. It is a medical system. So when organs are damaged, in such cases, palliation is the must. When the organs have been surgically removed, example, some 3 years back, I received one call from a Muslim girl, a woman rather, around 24 years age, and she got married recently, and she said, "Sir, I want to consult you. I would like to have a baby, so we need to consult you for infertility." I said, "Please step in." During the case taking, when I opened the file, both the ovaries were missing. What to do? Very impossible, right? So when organs have been removed, most of the times in our day-to-day practice happens, patients will call you, "Can you treat thyroid with homeopathic medicines?" We'll invite the patient. During the case taking, we'll come to know that thyroid lobectomy has been done, or total radical thyroidectomy has been done, thyroid has been removed. In such cases, you can't even. Such cases are very limitations for us. So when such cases comes, organs are affected or damaged, or organs have been surgically removed, or congenitally missing, congenital malformations. In such cases, palliation, even palliation has to be, cannot be promised. We'll have to give symptom similarity, symptom relief, and only we can do is improve the quality of life, whatever you can do, right? In incurable conditions and gross tissue damages happened, so cure is impossible because you cannot recover the patient completely. In such cases, deep acting constitutional remedies for curative purpose cannot be administered because you have studied Ken's 12 observations. Prolonged aggravation, final decline of the patient will happen. Killer's aggravation, to remind you, happens. So in such cases, palliation is the only resort. No other go. You can't do anything. In such cases, palliation is the only method you can adopt. Next slide, doctor. I just wanted to share this case, rectal adenocarcinoma. I treated this some 3 years back or 2 years back. I think I shared this case in some other platform also. It absolutely suits here. Mr. Ramanathan, I have taken the permission from the patient and their relatives also. He had a rectal adenocarcinoma, and doctors said, oncologists said, the disease has spread widespread, and the time given to them was only 6 months. So obviously, in such cases, conditions, the patients and their relatives, they brought the patient to us, homeopathy. And as we said, the case carcinoma or cancer cases, according to WHO, we cannot boast the cure. And because the gross tissue damage has happened, we cannot boast the cure in these conditions. So we have narrated the condition to the patient and his relatives. And the patient was very cooperative. And he said after explanation, "Doctor, I have seen life. Okay, I don't want to get operated either. I don't want to be bedridden. Please make sure that I don't get any pain, or I will invite death without any problem. So please palliate." That was the condition. So medicines were given to him. I'm not sharing the cases because the conceptual study we are doing here, not a case study. I'm presenting multiple cases here where palliation is the must. Cure is impossible. So such cases I'm trying to share here. So I can go through that. For controlling bleeding, I gave hamamelis. I usually resort in such cases to water doses. I'll share in question and answer if you have water doses in my method. And curcum longa, I am feeling is a very good remedy for, as I said, organopathic remedy in most of the cancerous cases. I've been using it regularly in mother tincture form. Based on the patient's sensitivity and susceptibility, I'm repeating it. So patient is feeling better, and after 3 years also the patient is still alive without any symptoms. Of course, according to Heinemann's theory, remedy doesn't help you. Okay, we have to resort to dietetic measures and also local applications and regime. Patient is active. Patient doesn't have any complaints as such. He is leading his life properly. And periodically, we are going for PET scanning to see whether the disease is progressing or not. So here I feel only palliation is the only resort, no other go. And this is the photograph. I have actually having video. Next slide, please. I have a video, but I don't want to play here, lack of time. A patient has thanked me after 2 years of treatment. The next one is the patient's daughter-in-law, a younger one, and she is a CA, chartered accountant, and she thanked me that they thought patient demise will happen within 6 months as per the specialist advice. But due to homeopathic symptom similarity, palliation, the patient is enjoying his quality of life. Right? Thank you. Next slide, please. As I said, what we learned during BHMS, we are going to apply. The philosophy chapters that we read along with Heinemann's theories is to share, is to get confidence on what the pioneers are teaching us. I don't want you to read the entire thing. Read only the italics and bold ones. In incurable conditions, according to H.R. Roberts, the administration of the similar remedy almost always ameliorates the situation. Amelioration is only possible, cure is not possible. Second paragraph, many seemingly incurable conditions, the simillimum will so completely meet the situation and will restore the patient to health. Only in condition where restoring organs is possible. In such cases, restoring the health is also possible. To quote example, majority of the autoimmune disorders, I feel. Allopathy doctors generally they'll say SLE in earlier stages they'll say, in advanced stages they'll say they resort to administration of steroids. Earlier stages of rheumatoid arthritis, and generally all we do in eczema, psoriasis, and earlier stages of asthma, bronchial asthma, we know that also comes under autoimmune disorder, allergic condition, hypersensitivity responses. Simillimum remedy can even cure the condition. The second paragraph is meant for that according to H.A. Roberts. The last one you can see, the law of similarity is the fundamental law also in the palliation of incurable states. Now, what is that teaching you? Final year students and newcomers. Okay, the case is incurable. Then what to do? We have to do palliation. How to do the palliation? The same principle. The same principle, law of similaris, is recommended by even by the pioneers. And we seniors have repeatedly verified that also. Then how to select the palliative remedy to make it more practical? See, cure, you are masters of cure because you have read Organon, you have taken the classes on Organon. You know how to take the cure, the causative prescription or the prescription based on totality of symptoms, covering mind, body, and everything you cover. The totality is constructed and you prescribe the simillimum remedy, which is suitable to the constitution of the patient, cure will result. But how to do the palliation? See, we know palliation is applied in incurable conditions. Palliation is applied in acute diseases where symptom relief has to be given immediately. So what we are doing, we are not covering the totality of symptoms. We are covering only the acute totality. That means most of the acute uncommon or acute common symptoms will be covered because our aim is to recover the patient. Our aim is to relieve the patient. So your totality changes here. Now, don't worry, I'm not deviating from the topic. I'm not deviating from the principles. That's why I'm quoting everywhere. Please bear with me. Go to case taking 82 2 to 104 aphorisms. 82 aphorism is exclusively given for acute diseases. Very few questions are needed, and patient on his own accord will explain the symptoms because he's suffering right now. So he'll tell you all the symptoms of his suffering. So he's limiting himself only to the current totality, acute totality. So for doing palliation, all you have to do is take the current totality and prescribe a similar remedy and administering the patient along with diet and regime. That is how the palliation is achieved. Next slide, please. Yeah. I feel last 2 years, I have been getting a lot of diabetic foot ulcer. Recently, last year, during AIHSAYA seminar, international seminar in Dubai, I presented, and this video is also there in my YouTube channel. I have treated around 30 to 35 cases of diabetic foot ulcer. I am just presenting one case here. This was the old case of mine. After curing such cases, people are coming to me. Diabetic foot ulcer, it is one of the complication of the disorder called diabetes mellitus. If the patient does not properly handle or control his condition, diabetic levels or sugar levels, it leads to diabetic foot ulcer. Now, Mr. Habib Ahmed, okay, he came to me with this condition. You can see the photo there. Okay, so he's already taking insulin for years. Okay, he wanted relief from this ulcer because the doctor was threatening to amputate the limb. So my plan of treatment was, he is around 66 years. He was very weak and he has been taking insulin for years. So I said, I'm not going to touch your insulin. I am not going to treat your sugar levels right now. You have to consult your doctor and you have to maintain your sugar levels on your own with your allopathy. Right? So I'm just going to save your limb. So based on the presenting complaints, I just, as you said, in third year, you might have studied the study of ulcers. The shape of the ulcer, depth of the ulcer, width of the ulcer, the color of the ulcer, and you can see the tissue, the formation over there. Based on that, I thought of giving initially with anthracinum. If you recall anthracinum, it is useful for not regular fresh ulcers, for generally diabetic ulcer, decubitus ulcers, rodent ulcers, the anthracinum is indicated. And second thing, you can see a black tar-like coating on the ulcer. And anthracinum is also having satellite ulcers. Along with the main ulcer, adjacent small ulcers will also develop. Anyway, based on that, I prescribed anthracinum. I use water dose only. Pills will be dissolved in water and the patient will take it repeatedly. And I learned one prescription from pioneers. Dr. Richard Hughes suggests Silesia in cancer pains, especially severe pains in ulcers, decubitus ulcers. Silesia 3x along with anthracinum I administered. Then followed by, when the improvement happened, followed by tarantula cubensis based on the symptoms. And finally arsenic alba, and ended with Artica events, one after the another. Next slide, please, sir. So you can see the symptoms started changing, right? The previously the symptoms, the presentation of the ulcer was different. After administering the remedies, the presentation is changed. Little health has improved. Next slide, please. And this is how the patient has recovered. Now we can see the progress of the symptoms. Here also one confusion comes. When I was a student, I had a confusion. Doctrine of series of remedies. See, every time the patient visits you, you must take the case. One single remedy or one single dose will never unlock the case because the pathology changes. When I met the patient, the miasmatic state can be taken as a mixed miasm. And when we administered the deep acting remedies or ulcer healing remedies, then the structure has changed, the miasmatic picture has changed. Now we have to reduce the miasm, probably from syphilitic to psychotic, from then psychotic to psoric. Now the patient is suffering only with the diabetes. But here I don't boast cure here, because we have only recovered the patient and we have saved the patient from getting amputated. As you said, removing syphilis and removing psychosis alone does not save the patient. We have to completely annihilate the disease. The cause of this ulcer was diabetes mellitus, which has to be addressed. Until unless you manage it properly, the cure you cannot boast here. Now I just did a palliation. I saved the patient, and the patient has recommended so many such similar cases to me. This is what I feel my analysis of this case. Right now, the patient is under my guidance, and he is maintaining his sugar levels. I have not stopped insulin, but I have reduced the insulin, but keeping him on diet. I thought of taking the case only when the patient sugar levels maintains for 6 months to 1 year continuously without any fail. Next slide, please. This is one more interesting case, colon adenocarcinoma. This lady is actually working in Indian Railways, and she met me some 4 to 5 years back. And she had colon adenocarcinoma diagnosed. And luckily, the case hasn't metastasized to other parts. So I said, being a cancer case, I don't want to handle it directly. So I recommend the case patient to undergo surgery. And after the removal of the surgery, I just wanted to put her on homeopathy. But patient was very cooperative. But anyway, on my force, she went to surgical removal. And after surgical removal, she didn't want to go for chemotherapy. And I don't know, based on the patient's confidence, I started handling the case. Symptomatically, I'm handling it. Constitutionally, I have selected one remedy. And weekly, once she receives the constitutional remedy, and symptomatically, I'm relieving her. Purely, I put her on diet, no sweet, no salt, and no sugar. No spicy food. Only bland food with protein diet. Natural diets, no preservative remedies, no packed food, and all. This is the diet I recommended to her. And every year we are going for PET scanning, and 4 years have passed by, and no metastasis has happened. Patient has rejoined our Indian Railways duties, and she is very happy. And she gave me a video also. I think this is not the platform. So the carry home message here is, of course, handling adenocarcinoma without any experience is very dangerous. I know, I agree, but a patient insisted. So based on the patient's recommendation, patient's confidence, I took up the case. Luckily, by God's grace, the case is going very well. So here, I don't boast cure. We are only giving quality of life to the patient. Constitutional remedy or organopathic remedies will save her. Maybe in the future, we'll have to see. And here, as you said, as you can see on the screen, I prescribed curcum longa as an organopathic remedy. Majority of the cancer cases, I am using it. Next slide, please. Right. Dr. J.T. Kent, celebrated by most of the Indian spiritual homeopaths. You know why I'm using the word spiritual? When Heinemann introduced a theory of chronic diseases, and he changed his law a little bit, then the homeopathic fraternity has divided into two groups. One group called miasm as a spiritual, dynamic, disease-causing or disease-producing powers. Another group correlated Heinemann's miasms as microorganisms and their products. I have a essay in my book, Comprehensive Study of Organon. You can go through that. Dr. Sarkar from India. Dr. Sarkar calls himself as a scientific homeopath because he believes that when Heinemann called miasms, he was talking about microorganisms and their products only. It's a controversial subject, not in our portion anyway. And Dr. J.T. Kent calls himself as a spiritualist. He doesn't take the word as miasms or microorganisms. Anyway, keeping it aside, even Dr. J.T. Kent also calls palliative remedy must be selected on symptom similarity. So there is no confusion both for curative and palliative purposes. The remedy has to be selected based on symptom similarity only. That is the carry home message for students here. See the second paragraph, italics and bold. No other way of palliation that holds out permanent hope for the patient. So even for palliation also, we have to select the remedy based on symptom similarity only. Next slide, please. A little theory for you. Summarizing. The merits of palliation is in life-threatening conditions, some initial relief is possible by palliation. Generally, what happens is we homeopaths does not handle. We fear to handle life-threatening conditions. The good thing that is happening nowadays is in Kerala, we have started a homeopathy cancer hospital. Government is also funding it, and their success rate is also very good. And I heard even in Delhi, doctors have started homeopathic hospitals, which is very good. You might have heard of Dr. Kopikar, S.P. Kopikar. He is no more now. I call him South Indian homeopathy Bhishmachar. A very, very famous doctor in South India. We were fortunate enough to work with him and we shared our views with him. And he has written a book, 70 Years of My Clinical Experience. I recommend you people to read that. 70 Years of Practical Experience by Dr. S.P. Kopikar. It is available on the internet also. Okay, he also shares very beautiful cases of his. And he recommends us, we homeopaths need specialization in homeopathy. Why we are limiting only ourselves to general practice? Why can't we advance? Few of them are good in infertility. One of my student, fifth batch student, I don't want to take her name, and she started her practice and she is doing very, very well in infertility cases. And she is also staring on social media. And some people are good in asthma, some people are good in cancer cases, palliation and all. So I feel we need, and this is possible only when we broaden our ways of application in curative process, in palliative process, even in no suppression. Okay, dietetic measures also we have to apply. How is this possible? See, after teaching Medica for a few years, I felt like you need a good knowledge of Organon and Medica. Both has to go hand in hand. Example, when we read CarboVeg in UG, we limit ourselves only as CarboVeg as a flatulent remedy. But we need to understand the remedy deep. We have to go to the core of the remedy. Then we'll understand that CarboVeg is not just a trio flatulent. It is also a very good remedy for varicose ulcers. It heals varicose ulcers, sloughing of ulcers. Please read lectures on homeopathic Medica, J.T. Kent. The essence of CarboVeg, Dr. J.T. Kent explains. Turgidity, turbidity, and air hungerness. These are the 3 points of CarboVeg essence. All you have to do is apply this essence in stomach. You'll have turbidity, turgidity, air hungerness, lack of power leads to flatulency. You apply the same central 3 points to circulation of carbohydrates, where the blood flows very slowly, ferments, then your deoxygenated blood stagnates there, and varicose ulcers happens, slowing of ulcers. Those ulcers doesn't heal and they keep on slipping. And when you read Apis mellifica in UG level, we read Apis mellifica as a jealous lady, widow, jealous widow kind of things. And edema, usually we remember edema in the lower eyelids. But you have to apply this edema not only to the generalized, you have to go to the localized also. Example, if you go to belladonna, if you go to Apis mellifica, if you go to Helleborus, if you go to Sina, all of them have the baby cries during urination. But the pathology in Sina is different, where the worm infestation causes irritation in the perineal area. That is why the baby will have burning sensation or cries while urination. Whereas in Helleborus, it is different. The pathology is different. Whereas in Apis mellifica, the edematous condition even go to the urethral level, which narrows the lumen of the baby. So baby cannot pass the urine because the lumen is very narrowed. See, such type of application when you do, that is why in NIH also in teaching methodologies, after the portion, you can you can see that the organon, Medica and repertory and pathology synergetically to be applied in our day-to-day practice. That is how the practice has to be. So palliation, please don't neglect palliation. Palliation has a place. It has its own role in your day-to-day practice. The more you palliate, the famous homeopathy or the famous doctor you become. Right? Thank you. Next slide, please. Yeah, you know that it's theory. In first year also, you might have studied demerits of palliation. Why we don't recommend palliation in curative conditions? Palliation does not cure you. It's a faulty method in curative process. Why it is faulty? Because it only temporary relieves like allopathy. Because allopathy is a palliative method, antipathy based on. The symptoms again recur and recur. As I shared with you recently, the diabetic foot ulcer case just now. Mr. Habib Ahmed, I have palliated the diabetic foot ulcer, but I don't boast as a cure because the cause is in the diabetes. Until unless you control the diabetes, the diabetic complications keep on recurring. Though second aphorism is not possible here. That is why palliation is not recommended in curative cases. Right? And by palliation, if you do in allopathy, every time you have to increase the milligram or dosage of the remedy. Repeated usage of palliative remedies might lead to artificial drug developments, iatrogenic diseases. That is why Hahnemann says iatrogenic diseases are very, very difficult to cure because along with the natural miasmatic disease, the drug disease also joins. You might have seen in Simply, I'll tell you. A patient comes with common cold. Most of the patients will go over the counter and they lick cetirizine or antihistamines. Instantly, it will dries up. But according to disease picture, the common cold, a treated cold lasts for 7 days, the untreated for 1 week. That is how the medical proverb goes. By taking cetirizine, he has just palliated his condition, but still the cold lasts for 6 more days. Then what is happening to the mucosal discharge? It accumulates. It doesn't go outside. So palliation is not a good solution in curable conditions. Okay, we have to try to cure in curative process, curative diseases. Next slide, please. Next slide, doctor. Yeah, thank you. This is one of the case of double vessel disease, cardiac case. I just wanted to share with you. Mr. Govinda Swami, 73 years. He came to me with 50 to 60% of two vessel blockage. Usually I don't handle. I never used to handle such cases. But the problem with this patient is his son deserted him. Nobody was there. So he doesn't want to go for a cardiologist. And he said, please handle this case. Whatever happens, we'll see. Right? That is how I started first case of my double vessel disease. I selected arnica because, double vessel disease or the blockage of the coronary vessels, the pathology is different, lifestyle disorder. So many other causes are there, multiple causes are there. We are not going to that level, academic level. But whatever it is, the blockage is there. We want to remove this. I have chosen the remedy arnica because it acts on the blood vessels. He was having high blood pressure also. I have chosen Ravalfia to control his blood pressure. And he was fond of mutton. Stopped that mutton intake. I made him vegetarian. Okay, so, and I prescribed arnica 1 ml, water dose repeatedly daily. And he took it repeatedly. Next slide, please. After 1 year of water dose, I don't know how patiently the patient might have taken the water dose. You can see the reports, 50% blockage. This is the first slide. Next slide, please. 50-second blockage, 50% blockage in both the double vessel disease, both the arteries, has come down to 10%. And patient was kept under the same medications. Whether fortunately or unfortunately, one thing happened with the patient. One day in the middle of the night, he developed chest pain, and nearby neighbors have taken him to a nearby allopathic hospital, and doctor checked everything and declared him cured. There was no blockage. It was only acid reflux. And patient reported me, and patient is healthy now. I'm just symptomatically managing him. Of course, this is a very dangerous case because there was no other option left out for the patient. I tried on my own. Okay, after that, I started handling 4 cases of such cases I handled. Double vessel disease. I had a chance of handling triple vessel disease, but I didn't handle it. The probabilities here is the collaterals may also develop, but of course, it's a risk, life-threatening. I agree that. So we need a lot of experience. We need a lot of experimentation from our side. We have remedies boasted in our Medica. They act on blood vessels. They are considered to be a good remedy for heart diseases, coronary vessels acting on, but we need a lot of research. I feel CCRH and research wings will do that. So in such cases also, palliative remedies and a good study of Medica can help us. Next slide, please. Again, Ken's quotation. Law of similaris is the only way. There is no other way for palliation. To understand palliation further academically, you remember final year students, we have a chapter, last chapter of J.T. Kent lectures on homeopathic philosophy, Dr. James Taylor Kent. Difficult and incurable cases palliation. I strongly recommend you people, please read that. Whenever you read pioneers' philosophies, please don't take it as a philosophy. Whenever they explain, try to keep one case in front of you. Imagine a case and apply that philosophy to that case. For first year students, whenever I take philosophy in the initial classes, I tell them, homeopathic philosophy is not a religious philosophy. Even Heinemann, aphorism number 9 to 11, during the chapter Vital Force, in a footnote, he says, what happens to that vital force, how this vital force cures, you will never understand a human brain will never understand. Please don't waste your time on these theories. Okay, just you have to understand that there is some curative power in our body, which we call it as vital force. So philosophy of homeopathy is not a religious philosophy. It is a practical philosophy. This is the essence of our pioneers. Either to cure the cases or improve the quality of life of the patient, you have to apply cure and palliation together. To add Heinemann's quotation, aphorism number 6, we understand it as unprejudiced observer, right? But go to the first line. The unprejudiced observer, well aware of the futility of transcendental speculations. Heinemann's quotes. The unprejudiced observer, that is the physician, homeopathic physician, well aware of the futility. Futility means uselessness. Transcendental speculations. See, most of the time we make fun of organon that vital force, vital force. No, don't waste your time on vital force. Second part, practical part is there, 71 to 298 aphorisms. Please read them. This is the most practical part. Heinemann is an experimentalist. He rejected the theories. He wanted us to develop homeopathy on practical grounds. That is what the first line of the 6th aphorism will tell you. Please don't waste your time. It is futile to spend your time on transcendental speculations. We need more cases. We need more experience. We need more research on that. Next slide, please. Yeah, what are the other conditions where palliation is useful? Mechanical and surgical cases. Another confusion, most of the students, even in final year, they'll ask you, sir, we don't have external application. Then I'll ask, then why are you preparing ointments in pharmacy? We have a test also. They'll ask question, please prepare ointment, external ointments, external liniments. Then why are you preparing it? Is it classical? Can you reject? Then why do we have Tuja ointment? Why do we have calendula ointments in the market? Are they not classical? Now there is an answer in organon. Go to local melodies. Local melodies are two types: local melodies of internal origin, local melodies of external origin. I'll make it very simple. I don't want to go for a big answers. Organon is itself is very boring, right? I am shaving, and I'm shaving very fast. And I had a cut over here, which is very deep and depth. Then what do? I'll use calendula. Here, the external application is recommended. In mechanical cases, example, a driver is there, or nowadays, IT professionals are there. IT professionals are using their hands continuously, they're lifting shoulders, they are using their neck and back constantly. They develop lumbar spondylitis or lumbar listhesis kind of, or cervical spondylitis in such cases where there is no miasm. Most of the mechanical causes like injuries, most of the mechanical causes like musculoskeletal disorders, you don't have a miasm there. You may classify them under psora if you want, but they are the mechanical problems. Because of the bad sitting habits, because of the bad lifestyle disorders, they have developed it. All you have to do is correct it, recommend them some exercises, and give some palliative remedies to soothe the anatomy. Next slide, please. So regarding the same, I just wanted to, the similar case. I had a case of olecranon bursitis. Okay. Next slide, you can see the photo. This is what the condition. The patient was very old, 81 years. Doctor recommended drainage of the bursa liquid. But anyway, I just wanted to try homeopathic palliation. So I have chosen Ruta based on the structure involved. I gave Ruta 0/1 and 0 first I tried 1 m water dose, nothing happened. After water dose, then next I shifted to the same Ruta 0/1, which improved nicely. And you can see the photo. You can see the photo. Ruta acted there. Ruta acted there because it was a mechanical compression. Because of the mechanical compression, bursitis has resulted only in the one part. Patient was very hale and healthy, no sugar, no BP, nothing was there. So purely based on the Ruta pathology. Again here, one more thing, students. Whenever you read any Medica remedy, sphere of action, where the remedy acts, that also you have to keep in mind. Ipecac, if you go, it acts on the pneumogastric nerve. From the pneuma part, you have asthma in children. It acts on their gastric concept. It produces persistent nausea and vomiting, which becomes a concomitant symptom of associate symptom of ipecac everywhere. So you have to read the drug picture not only in personality or constitutional level, even at the pathological level, you have to read. You need a quotation, pioneer's quotation here in this support. I recommend Richard Hughes. If you go to Richard Hughes individualization chapter, Richard Hughes recommends you to individualize any case under three headings. Individualization in constitutional level, individualization in systemic level, individualization in disease level, particular level. In a curative condition, Richard Hughes says, because the disease is curable with homeopathy, there is a time for action of the remedy. So all you have to do is you have to individualize constitutionally, patient as a whole. In some systemic disorders, as I said in the previous case of coronary artery disease, where we don't have time, right? The patient, initially the blockage has to be removed. The cardiovascular system. So individualization on the systemic level will have to be. Maybe it's a crude example, pathological example. And third one, excuse me, whatever you see here on the screen, this is the individualization on the pathological level. As I said in the beginning, in such cases, you are not going for a constitutional selection of the remedy because this is resulted because of the mechanical compression constantly. Here, not the constitutional remedy, but a palliative remedy has to be administered. Next slide, please. One more thing is nephrolith. Majority of the homeopathic doctors all over the world, they are doing very well in removing the kidney stones. We can remove kidney stones with our remedies. We have lilianthal, we have therapeutics. Please individualize every kidney disease or kidney remedy individually. Every remedy is different from each and every remedy. That is how you have to master Medica. When the stone has blocked in the ureter, initially we cannot think of the curative process. Initially, we have either mechanically remove it by sending him for surgery, or if the patient is cooperative or patient is in a healthy level, we can even think of removing the stone with our homeopathic medicines. Homeopathy does wonders. You can go through, as far as my experience is concerned, I have one video in my YouTube channel. I have given around 50 to 60 cases of mine where the patient, by administering homeopathic medicines, we can remove the stones. I think I need not put more light on that. Next slide, please. Salivary stones. Blockage is the result. So homeopathic medicine does wonders. This is one case of salivary stone which I treated because I feel it is more of a mechanical obstruction there, which has to be removed by administering homeopathic medicines. What I ask the patient is to clean the mouth, oral cavity, with a spoon of lemon and a pinch of salt. And after brushing the teeth, she has to gargle her or rub the oral cavity with this solution along with my homeopathic medications. And she is good now. There is no recurrence. I feel this mechanical obstruction has to be removed with palliative homeopathic remedies. Of course, after that, we'll have to find out the case. Palliation is not a cure, as I said. It has to be followed with constitutional remedy and as per the chronic disease advice, principles of chronic diseases. Next slide, please. Another case is osteoarthritis. I think really challenging for any homeopathic doctor. Even I am still to master osteoarthritis. Every osteoarthritis case is very challenging to me, very difficult for me to treat. Here, osteoarthritis, most of the cases is not because of any pathology. It is most of the cases, it's an old age problem. So here, the cure may not be possible. All we have to do is symptomatically relieve the patient. Osteoarthritis is such condition where palliation is needed in old people, according to me. Until unless pathology is there in the background, if it is secondary to some other problem. Next slide, please. Perianal abscess. Majority of the cases, I'll never recommend surgery. I treat this case with homeopathic remedies initially by using pyogenic remedies like Silesia, Muxol, Heparsulf, Calcarea fluor, Calcarea phos. We can easily remove the pus and later followed by constitutional or dietic changes and everything. So perianal abscess is also a condition, or even piles, fissure, fistula and ano are the conditions where homeopathy can do wonders for relieving the patient. Palliation is very much applicable here. Please go through Lilienthal remedies, differentiate each remedy in the pathological condition. Next slide, please. Yeah, palliation generally we do in our day-to-day practice in acute cases and acute exacerbation. As far as acute case is concerned, in the beginning of my practice, I explained it. Another confusion I feel most of the students ask is they confuse between acute case and acute exacerbation. I feel we need to put some light on that. Acute cases, I gave the example of cholera, typhoid, malaria. These are the classical acute cases where the bacteria comes in. Okay, we can cure the bacterial condition. You can read Stuart Close Scope and Limitations of Homeopathy, where he has given a very beautiful explanation of even homeopathy is very good in bacterial and viral infections also. That is acute case. Now, acute exacerbation. Doctors and PG students, you know it. This is for UG students who are still in confusion. Example, you are treating a case of migraine. Patient, if comes with migraine attack right now in front of you, you have to relieve the patient by giving acute remedies. You have to relieve the patient by giving acute migraine remedies, location, sensation, modality, concomitants, and you have to relieve the patient's migraine. Because some people's migraine attack may remain for around 2 to 3 days. The condition of the patient will be very pathetic. Once the patient recovers with your acute remedy, then you have to prescribe a constitutional remedy. Even Dr. Dr. Kopikar and majority of the pioneers, they recommend the best time for constitutional remedy classically is not during the acute attack or acute exacerbation, but the constitutional remedy has to be prescribed after the acute exacerbation is over. Even if you go to intermittent diseases, alternative diseases in Organon, Heinemann also in 6th edition of Organon recommends the best time for administering constitutional remedy or intercurrent remedy is not during the acute exacerbation. So migraine, when the patient comes with acute headache, you have to control the acute headache with acute remedies. Once the patient recovers, then you have to administer the constitutional remedy for curative purpose. So this is how the palliative and curative remedies have to go hand in hand. Right? Next slide, please. I had a chance of handling COVID during the COVID times. I just wanted to share. Even homeopathic medicines are effective in acute bacterial and viral infections. You can see the report. The report has become negative. Patient has recovered also. This is the one case in acute exacerbation I just wanted to share. Next slide, please. So read the bolts. H.R. Roberts also says the best way to alleviate the pathology in any disease condition is symptom similarity. So simillimum remedy. The only possibility is to palliate the condition. The simillimum remedy has to be selected for the disease condition, whereas for curative condition, the similar remedy has to be selected on constitutional basis. This confusion you have to clarify. Next slide, please. Thank you all. So I feel I have put a light on palliation and curative process. I could not share the case presentations because the concept today is only to differentiate between palliation and why the palliation must be applied in our day-to-day practice. Thank you all. Thank you very much.
Thank you, sir. Thank you so much for your valuable suggestions and valuable webinars, whatever the cases you have treated and whatever the suggestions you have given to the students also along with that. We'll be glad to that, sir. Definitely it will be light to the students to learn something, sir. So moving on to the question answer session, sir. Respected participants, if you have any questions, kindly comment in the comment box so that sir will be answering. Yeah.
So Sunday is a free day, no questions, I think.
Yes, sir. I think they have been clear with the topic also, sir. I hope so.
Okay, fine. Thank you.
Because you have explained everything in detail in such a way that everything is so clear and it was been insisting in the mind instantly, sir. Yeah, sir.
Thank you. Thank you.
So, so I hope the participants are also clear with the session. So thank you so much, sir. We'll be looking forward for many sessions from legendaries like you. And thank you all the participants for your active participation. And we'll be back with the other exclusive session with many legendaries. And thank you, sir. Thank you all the participants. Yeah. Thank
Thank
you, sir.
you. Thank you, one and all. Thank you for having me here. Thank you.
Thank you,
Bye.
sir. Bye.